Good afternoon. I want to thank you for coming to this press conference here today. My name is Jeff Gorell, a Ventura County Supervisor representing the 2nd District. A couple of housekeeping items first. I do want to let you know that our comments are being interpreted into Spanish by Anna, who's here, so we're going to be speaking probably a little bit slower than normal just to allow her to keep up. And then we'd also ask you, if you have any questions of any of the speakers, that you just reserve those questions until the end of the speakers have concluded. We would very much appreciate that. I'm going to start by saying that the passing of Brian Ashheim last month struck a chord in this community, and it's heartbreaking, and we grieve his loss. The goal for today's press conference is for the Ventura County Medical Examiner, Dr. Christopher Young, to share the final results of his autopsy examination of Mr. Ashheim. This press conference is also an opportunity to share with the community the many bold actions and investments that have been made to address homelessness and to end homelessness in this community and in this county. I'm going to start by asking Dr. Chris Young to come up from the Ventura County Medical Examiner's office. Thank you.
Good afternoon. I'm Dr. Christopher Young, Chief Medical Examiner for Ventura. On March 8th, 2024, the Thousand Oaks Acorn ran a story about the death of 56-year-old Brian Ashheim, who died at a homeless encampment on February 8th in the city of Thousand Oaks. At the time of the article, the cause and manner of death were still under investigation. Mr. Ashheim was found unresponsive in his tent and pronounced dead by paramedics. The death investigation performed by the Ventura County Medical Examiner's office included a scene response and complete autopsy, including toxicology testing, histology analysis, and bacterial cultures. 3 days prior to his death, Mr. Ashheim was evaluated at a hospital for generalized weakness, nausea, and tremors. He was found to have mild hypothermia and was administered fluids and released later that day. Although temperatures around the time of death had been in the 40s to 50s with rain, showers, he appeared to have adequate shelter, bedding, and clothing. The autopsy revealed severe heart disease and liver damage associated with chronic alcoholism. Autopsy and scene findings commonly seen in the setting of hypothermia were not present. The conclusion of our investigation is that Brian Ashheim died as a result of heart disease and chronic alcoholism. People experiencing homelessness are a vulnerable population with an increased risk for premature death from either natural or unnatural causes. Unhoused individuals may be less likely to receive life-saving medical intervention when experiencing a medical event. They are also more likely to die from unnatural causes. In 2022, 45% of all deaths investigated in Ventura County were accidents. In contrast, 71% of unhoused individuals' deaths were accidental.
Thank you. Thank you, Dr. Young. It's important to note that Dr. Young's and the medical examiner's entire report is being made now available in its complete entirety by making contact with his office if you'd like to receive the full report. As you heard from Dr. Young, the cause of death for Mr. Ashheim was complicated and chronic. The plight of every one of our unhoused neighbors is complicated, and each has their own individual challenges to address. And therefore, addressing homelessness is itself very complicated and requires all hands on deck approach, and that's what we are doing here in Thousand Oaks, and that's what we are doing here in the county of Ventura. I'm very proud of bold actions that have been taken recently by the Ventura County Board of Supervisors, and I think it's important to share the strong action-oriented partnership that our county has with our cities in the county, including and specifically Thousand Oaks. Just the Tuesday before last, 15 full-time positions were authorized and funded by the Ventura County Board of Supervisors, and they include Human Services Agency with the County of Ventura, the Sheriff's Office, and the CEO's office. These positions will bolster the county's capability to address homelessness effectively and efficiently with an increasingly coordinated and agile approach. Specifically, 2 new homeless service workers, social workers positions were created and expand our homelessness prevention program. And our homeless services program assistant position will support homeless data analysis and are included as part of our expanding staff. We created a position of homeless solutions director, and we created a position of housing solutions director. When I first started with the County of Ventura early last year, I asked who is responsible for homelessness, and at that time, there were more than 5 people that were named. Moving forward, we have 1 person that will be our homelessness solutions director and 1 person responsible for housing. And that's incredibly important for 1 person to be where the buck stops to quarterback this important initiative. We also authorized and funded 8 additional deputies and 2 sergeants that are added to the Ventura County Sheriff's Department. The sheriffs will expand its homelessness liaison unit, and that unit will provide increased support to connect unhoused individuals with services, provide security to social and healthcare workers working in the community, and to facilitate cleanups and actively engage with the community to educate and build relationships with our most vulnerable populations. The actions taken by the board are a multifaceted approach to reducing homelessness, including in the application up to $2.6 million in homelessness housing assistance, a prevention funding through the Ventura County Continuum of Care. This funding will support 2 years of homelessness prevention efforts aimed at keeping up to 500 households in stable living condition and housed and sheltered. Since 2018, the county has offered to partner financially for both construction and operation for permanent emergency sheltering to our local cities. To date, the county has formal partnerships with a number of cities, including 4 shelters representing 244 beds. That includes the city of Ventura's 55 shelter beds, Santa Paula's 49 shelter beds, Oxnard's 110, and Thousand Oaks' 30-bed shelter scheduled to come online in late 2024 or very early 2025. Our county of Ventura takes very seriously the top issue of homelessness. We are engaged at the highest level with all hands on deck to partner with our cities, with our different agencies at the county level, our community-based organizations, which bring an important element, and then our state and federal partners to ending homelessness. We're committed to doing that. I'd like to invite up the next speaker. That's Dr. Loretta Dennering, the Interim Director of Ventura County Behavioral Health, to discuss activities going on with behavioral health to address homelessness. Thank you.
Thank you, Supervisor. Good afternoon. For years, Ventura County Behavioral Health has engaged in outreach and engagement activities to our most vulnerable residents through coordinated efforts. Our Rapid Integrated Support and Engagement, otherwise known as RISE program, is designed to support bridges to treatment for individuals who are unable or unwilling to access help. Through the County Healthcare Agency's Backpack Medicine program, we collaborate with partners in primary medicine to provide integrated healthcare outreach, addressing mental health and substance use needs in conjunction with physical health conditions. For several years, our RISE team and local law enforcement agencies have partnered with the goal of supporting individuals in the community and to assist in linkages to services and resources. We look forward to supporting the expansion of these outreach and engagement efforts under the expanded Homeless Liaison unit under the Sheriff's Office. To date, in collaboration with various county and city partners, Ventura County Behavioral Health has been involved in the development of over 200 existing permanent supportive housing units through various projects and sites. We also provide services for many permanent supportive housing programs, including expanding contracts with adult residential facilities and residential care for elderly facilities, which provide 24-hour care. We also continue to expand efforts for contracts for recovery residences for individuals engaged in outpatient substance use disorder treatment. The department has been successful with several No Place Like Home co-applications and currently has over 100 No Place Like Home units in the pipeline for the next 2 years. Last year, we received funding through the Department of Healthcare Services Behavioral Health Bridge Housing Program for new short-term and interim housing, including permanent and supportive housing units, new shelter beds, and housing navigation services. While we await the official results of Proposition 1, should the measure pass, Ventura County Behavioral Health stands ready to work in partnership with the state to faithfully implement. We are preparing now to ensure that the Behavioral Health Services Act successfully serves our clients. We welcome increased focus on building more housing and treatment spaces for our clients. The data is clear. A lack of affordable housing and not behavioral health is the main driver of homelessness across the state, which tends to exacerbate mental health and substance use disorders. Today, we are providing mental health and substance use care to many people without a permanent residence. The proposed legislative changes under Proposition 1 mean more housing and treatment spaces to benefit the clients our county serves. And we know that housing helps in healing. Thank you.
Thank you, Dr. Dennering. I'd now like to invite to the microphone Ingrid Hardy, the Assistant City Manager of the City of Thousand Oaks.
Good afternoon, everyone. Thank you, Supervisor Gorell, for organizing today. First of all, I would like to express my condolences to Mr. Ashheim, his family, friends, service providers, and others who knew him. Addressing homelessness and affordable housing is of paramount importance to our City Council. It has been a top priority for the last several years. Most notably, the City Council has dedicated city-owned property. They've allocated millions of dollars, and as a city, we have also committed staffing resources to address homelessness. At the beginning of this calendar year, the City Council authorized contracts to build and operate a navigation center, which is a low-barrier, service-enriched shelter to serve people who are unhoused. This will be a 30-bed navigation center with the opportunity to expand up to 50 beds. This mission-critical project, which is the first of its kind in the East County, is critical in helping our city address homelessness. We will be able to bring the unhoused indoors. They will be able to receive wraparound services, and the most important goal is to get them connected to permanent housing. The Navigation Center is expected to break ground next month and hopefully will be completed by the end of this calendar year and available for services. Having a year-round navigation center is also important since several years ago, we used to have a rotating winter shelter in Thousand Oaks, and that service is no longer available, which is one of the reasons why the City Council has expressed the urgency in getting this facility built in Thousand Oaks. The city also has supported and continues to support local nonprofit service organizations through grant dollars to help them also provide services to people who are experiencing homelessness, as well as those at risk of homelessness. Last but certainly not least, forward progress has only been made as a result of, or one of the results of that forward progress is because of our partnership with the Ventura County Chief Executive Office. We work in close partnership with the Ventura County. We also have received a state grant to build the Navigation Center and also our partnership with law enforcement. And with that, I will conclude my comments. Thank you.
Thank you, Ms. Hardy. I'd like now to invite to the microphone Thousand Oaks Police Chief Jeremy Paris.
Good afternoon. I'd like to start by saying I'm grateful to live and work in a community where so many people are concerned about this problem. It is a big problem in society right now. It's a complicated problem. I'm grateful for elected leaders who've been willing to put forth the resources necessary to address these problems. There's a couple controlling cases that have made enforcing issues around homelessness very difficult for those. They include the Martin versus Boise case and the Johnson v. Grants Pass case. Those cases take a long time to sort out. They're still fairly new case law. And because of that and the changes that come along with those, the Sheriff's Office has recognized for a while now that we need specialized officers to address these problems. That's come in the form of homeless liaison officers. The first homeless liaison officers started in Camarillo in 2013 in a program called Project Hope. Just a short time after that, the City of Thousand Oaks started its Vulnerable Population Officer Program. These are dedicated full-time officers that work only on homelessness issues. And it's important for two reasons. First, they have to understand the law. That's complicated. They have to keep up with the changes to the law, which seem to be very frequently. But the other important part is they need to have really good relationships, not only with the homeless persons in our communities, but with the service providers and with the county counterparts in behavioral health. And that's been a really successful model for us, expanding into, in 2016, in 2021, a collateral team of homeless liaison officers for the entire county. And then most recently, here in Thousand Oaks, just last year, we took a deputy on every shift and also trained them in how to enforce these laws and provide resources. And then just this past month, the county has authorized the additional resources that the supervisor spoke about. It's always important to remember in all these competing interests is that our goal is to reduce harm. Our goal is to provide services to the homeless and ensure the safety of both the homeless and the people that live here in this community. Thank you.
Thank you. I'd like to invite the speakers up a little closer to the podium and then see if there's any questions that we can answer from the folks here. Any questions? Yes, sir.
So we did the question was related to the cause of death being heart disease and alcoholism. We did consider hypothermia as a potential contributor, but the scene investigation showed that he had adequate shelter and clothing for temperatures that were present. It was raining when the investigation took place, and the tent had been opened up, so things were getting damp from that. But we didn't see the typical findings that we see at autopsy either that are sometimes indicative of hypothermia. So there's really nothing subjective evidence that indicates that contributed to death. He could have been cold, but there's nothing to say for sure that hypothermia played a role.
Yes, Becca. Yeah, please, Ingrid, thank you.
So the question, So the question is whether or not there's an update on the Home Key project in Thousand Oaks. And at this time, the status is the same. The city, we continue to be in communications with the State Attorney's General Office, as well as the Department of Housing and Community Development. Our goal is to see that project completed and used for its intended purpose. But we're a little stagnant at the moment, but we continue to work towards that without losing focus on that end goal.
And the county continues to remain a steadfast partner in that project and all of the work that the city of Thousand Oaks is doing. Any other questions? Sure. Is there 911?
Yeah, I don't have any.
Yeah, it's something that maybe we could look into, but nobody has that information immediately here. Anyone else? Yes, Becca, of course.
Yeah, sure. The question was about balancing the needs for shelter along with enforcement. And this is why we have these specialized officers. It's very complicated for us. The key word here is reasonableness. We're looking to make sure, first, life safety is first, right? So we don't want to put somebody in harm's way. And so that includes shelter. So you will see people using tents, especially during inclement weather, that we're going to allow them to use tents to make sure that they are in a position where they can be okay and be taken care of and out of the weather.
All right. We'll at least myself, I'll remain available for anyone that'd like to ask any additional questions or follow on. But other than that, thank you for being here today and for participating in the press conference. Appreciate it. Yeah, there's a Spanish interpreter, but not a Spanish speaker. No, is there? You have somebody from your office, perhaps? Okay, thank you very much. That concludes the press conference.